Hi, my name is Erin Ives, and in this video I will be demonstrating stoma site marking. First, I'll have the patient lie supine. I will ask the patient to tighten their abdominal muscles as I palpate for the edge of the muscle. Once the rectus abdominal muscle has been located, I will check for any body creases or scars and look for a flat pouching surface. The stoma should be located within the abdominal rectus muscle in a location that is visible to the patient and possibly below the belt line to help conceal the pouch. Once the most ideal stoma site is located, I will use a stoma site marking disc to ensure there is a 2-inch border for the barrier system on a flat plane. A circle will be drawn to mark the stoma site. The quadrant choice can also be influenced by what type of surgery the patient will be having. Ileostomies are commonly on the right lower quadrant and colostomies on the left lower quadrant, but this can vary. Next, I'll have the patient sit in a relaxed position with feet on the floor. I will observe for any contour changes, making sure the site is within patient view by having them point to the mark and using the marking disc to ensure the 2-inch border is still flat. This patient still has a clear line of sight and had minimal contour changes. The stoma site is below the belt line, so it will not be an issue with clothing and can also be better concealed by clothing. Most importantly, the peristomal plane is still flat. I will then have the patient stand to assess for any downward pull by gravity, again checking to make sure the peristomal plane remains flat and the patient can point to the site. This patient has a clear view of the site and the peristomal plane is flat. The site would then be marked with a surgical pen and covered with a clear adhesive dressing until surgery, instructing the patient to keep area clean and dry and not to remove the dressing.